It was reported yesterday that there are now 4 confirmed cases of the chikungunya virus in the Bahamas, and health officials can see that those numbers are expected to rise. Deputy Chief Medical Officer Dr. Delon Brennan gave a breakdown of the cases which have been uncovered.
Been able to trace that 2 of those cases definitely did have travel, and so we know that it's likely that they went to an area that is now essentially with a higher burden, and so we know where they got it from. The 3rd case we're actively investigating right now, so hopefully we'll also be able to do that. But the likelihood again is the more cases you get, the more likely it is that we're going to get local transmission as well. So we can't rest our laurels and say, oh, it was imported, so we don't have to worry about it. We're going to get more cases at some point. With the amount of travel, especially during the summer with people going places and other people coming to visit us, we're going to have more cases. What we need to do is continue to make sure we protect and we identify those cases. So
Brennan says residents know all too well the impact the dengue fever had on communities 2 years ago. And with the pending outbreak of chikungunya, he says dengue still remains a threat and persons may have both diseases presenting at the same time.
Is the 2 don't really cause as much of an issue. You can get them together, so unfortunately it's just going to mean that you're going to be sicker than you would have been with one versus the other. It doesn't necessarily increase your mortality a lot more if you were to have had dengue in the past and now get chikungunya. If you get one strain of dengue that you've had before and now you get another strain, yes, that causes you much more of an issue. But the fact of the matter is, because we're in a time of the year where we have rain, we have the mosquitoes, we have the circulating virus, people are going to be susceptible to both. And so we really have to make sure that we protect each other, protect ourselves against mosquito bites regardless of whether it's specific to dengue or chikungunya.